Hello friends, welcome back. In this session, we are going to discuss about abortion, focusing on MTP Act Amendment of 2021. So at the end of this session, we should be familiar with definition and classification of abortion, MTP Act of 1971, especially its amendment as well as MTP rules of 2021, various sections of Indian Penal Code governing criminal abortion in India, that is section 312 to 316 IPC, and the methods and complications of criminal abortion. The term abortion comes from the 16th century Latin word aborire, which means to get detached from the proper site or simply to miscarry. There are legal as well as medical definitions for abortion. Legally, it is defined as the premature expulsion of products of conception from the uterus at any time before the complete period of gestation. In medical legal sense, normal pregnancy duration is considered as 10 lunar months or 40 weeks or 280 days. As you know, the lunar month means 28 days month. The expected date of delivery is calculated by applying Nagel's rule, that is, to the first day of LMP we have to add 9 months and 7 days, or we have to deduct 3 months and add 7 days to arrive at the due date. But as ovulation and the subsequent fertilization of pregnant woman occurs only by 14 days after the first day of LMP, that is, woman actually becomes pregnant from the date of fertilization. If you calculate from that time, the actual duration of pregnancy comes around only 38 weeks or 266 days. Whereas medical definition of abortion is the premature expulsion of products of conception from the mother's womb before the age of viability, that is before 28 weeks. If it occurs after 28 weeks, it is called a stillbirth. The viability is defined as the physical ability of the fetus to lead a separate existence after birth apart from its mother by virtue of certain degree of development. To put it simply, the fetus is born after 28 weeks. It is capable of surviving on its own without depending on the maternal circulation for its survival. But conventionally, or usually, the abortion is one where the expulsion occurs in the first trimester, that is up to 12 weeks. For the second trimester expulsions, we call it as miscarriage, that is between 13 weeks and up to 28 weeks. Whereas premature birth is one that occurs after 28 weeks before full term is completed. That is called a premature birth or premature labor. You can see in this picture difference between the legal definition and the conventional definition of abortion. Medically, it is conventionally called as the expulsion occurring in the first trimester as abortion, second trimester miscarriage, third trimester is a premature labor or premature birth. Whereas legal definition, irrespective of trimester, whenever the expulsion occurs, it is termed as simply abortion only. As you are seeing in the picture, A represents the first day of LMP, B represents the date of ovulation, C represents the first trimester period, D represents viability, E represents that full term. So the duration of pregnancy is generally estimated for convenience from the first day of LMP and up to the date of parturition, that is A to E. Whereas actual duration of pregnancy starts from the date of ovulation, that is from B to E, which comes around 38 weeks instead of 40 weeks. Then the abortion, the legal sense, is one which is occurring any time between A and E, that is from the first day of LMP to the parturition. Whereas in the medical sense, abortion is one which is occurring before the age of viability, that is between A and D only. A and D is the precise medical definition. Now we have to be familiar with the various terms pertaining to this topic. The first 2 weeks of conception, the product is called a developing ovum or pre-embryo till the implantation of that product in the endometrium occurs. Whereas after implantation occurs, we call it as embryo, that is after 2 weeks up to the end of 8th week. Otherwise, after 2 weeks up to the end of 2nd month. Then, after 8 weeks, that is from the 3rd month onwards, we call it as fetus till birth. As you are seeing in this picture, in the middle one is the embryo. That is from 3 to 8 weeks after implantation occurred. Then, from the 9th week onwards, or from the 3rd month, we call it as fetus till the 10th month. Because from the 3rd month only, in the embryo, the neck appears. Neck appears in the fetus by 3rd month. So, that gives a human shape to the embryo. So, we call it as fetus from 3rd month onwards. The aborted embryo or fetus, that is the product of conception, especially in the first trimester, we call it as abortus. Now coming to classification of abortion, generally it is classified as natural or spontaneous, that means non-induced, artificial or induced abortion. Then this natural abortion is further classified into isolated and recurrent. Recurrent means 2 or more consequent spontaneous abortions occurring in a pregnant woman. This artificial induced abortion is further subdivided into justifiable and criminal abortions. Then this natural abortion is further subdivided into threatened, inevitable, complete, incomplete, missed, septic abortions, etc. Threatened abortion is one which occurs before 20 weeks, associated with vaginal bleeding, but without cervical dilatation. That gives indication that a spontaneous abortion occur anytime. Whereas inevitable abortion is one. There will be a vaginal bleeding, rupture of membranes, either of that may be there, and there will be a cervical dilatation as you are seeing here. So abortion becomes inevitable or unavoidable. Incomplete abortion is one where some products of conception are not getting expelled. They are still retained. Missed abortion means undirected abortion by the pregnant woman. So the retained that abortus is remains undirected because there is no vaginal bleeding, there is no cervical dilatation. Normally, once the fetal death occurs, it got expelled in 2 or 3 days time. Sometimes that doesn't occur and it remains retained for the prolonged period, leading to complications like severe uterine bleeding or septicemia in the pregnant woman. Similarly, incomplete abortion also, that has to be removed. The retained products to be removed because that also will produce similar complications. Complete abortion means that one, in contrast to incomplete abortion, complete expulsion occurred. Septic abortion is one where the uterine infection occurs soon that is immediately after the abortion or during the abortion or just prior to abortion, leading to maternal infections. There are other types of abortions like early abortion, which means abortion occurring in the first trimester. Then if it occurs later, then it is called a late abortion. Now coming to natural or spontaneous abortion. Natural or spontaneous abortion is about 15% of all pregnancies, and that to occur especially in the first trimester, mainly 2nd or 3rd month. That is the most common vulnerable period in a pregnant woman. There are various causes for spontaneous abortion. Genetic are the most common causes, constituting 50% of natural abortions. Then other factors like anatomic abnormalities like cervical incompetence, endocrine abnormalities like hypo or hypothyroidism, maternal infections like torch infections in the pregnant woman, immunological factors like ROC incompatibility, then others like environmental factors, for example, chronic lead poisoning. All these may cause spontaneous abortions. Of the most common cause, that is 50% of the spontaneous abortions occur due to chromosomal abnormalities, of which autosomal trisomies are the most common, especially the trisomy 16. Trisomy 16 is the most common autosomal trisomy constituting chromosomal abnormalities in the pregnant woman. Coming to second type, that is artificial or induced abortions, which are deliberately induced. They are further subdivided into justifiable or therapeutic abortion, which means the abortion is done as per the provisions of the MTP Act, otherwise called a legal abortion also. Whereas a criminal or illegal abortion means that a deliberate abortion that is done outside the provisions of MTP Act. And as far as the abortion is, that is a person who is conducting abortion, there are three types. Skilled abortionist means they are nothing but medically qualified professionals, either registered medical practitioners or physicians with either diploma or master degree in the obstetrics and gynecology. Whereas semi-skilled are those who are having some fundamental knowledge of anatomy, but they are not having necessary qualifications or experience for conducting abortions. They are nurses, midwives, chemists, etc. Unskilled are those who neither have this basic knowledge of human anatomy nor having the necessary experience or qualification. They have rudimentary knowledge of anatomy only. They are quacks or untrained DICE. DICE means traditional birth attendants in the rural regions. Now, coming to medical termination of pregnancy, it is defined as the procedure that uses medical or surgical intervention or sometimes medical and as well as surgical methods to terminate the pregnancy. The initial weeks of pregnancy, like up to 9 weeks, generally these MTP pills, hormonal pills, will induce abortion. When the pregnancy crosses that period, then these pills won't work out. Then we have to do this surgical intervention like dilatation and curettage, dilatation and evacuation, simply called a D&E, etc. Depending on the duration of gestation, surgical intervention is required. Sometimes combined surgical as well as medical methods also used. Now coming to various issues surrounding the abortion in India, there are religious beliefs. Like some religion won't permit abortion. Then ethical and moral values pertaining to killing of the unborn child. Then social and cultural values are there. Medical ethics, because the doctor's role is to protect the life of the individual, whether it is ethically correct to terminate the life of the unborn child. The rights of mother versus rights of unborn. Rights of mother versus rights of father. The issues become even more complicated pertaining to unmarried women getting pregnant. Then various laws and legal provisions governing abortion in India. In the world, there are always proponents and opponents arguing for or against the abortion, because abortion is a highly emotive issue like euthanasia or giving capital punishments like that. In the world, around 26 countries, all abortions are prohibited, and 39 countries, abortion is permitted only if the pregnant woman's life is at risk due to continuation of pregnancy. In India, about 6.4 million pregnancies are terminated every year, and 13 women die each day due to complications of criminal abortion. The unsafe abortion constitutes the third leading cause of maternal deaths. Sometimes the court refuses abortion even in minor rape victims. It is said that 17% of 82 cases between 2016 and 19, the minor rape victims are refused abortions. This amendment of 2021 that comes exactly 50 years from the original act, that is MTP Act of 1971. And this amendment came into force by September 24th of 2021. This amendment is progressive in nature, keeping in view of the progressive changes in the societal norms. The main amendments in this 2021 Act is the extension of duration of gestation from 20 weeks to 24 weeks, that is upper limit, and even beyond that, even after 24 weeks also it can be permitted, provided it is done under the supervision of state level medical board, only on the ground of there should be a substantial fetal abnormality. So even beyond 24 weeks it is permitted. The previous amendment up to 20 weeks only it is permitted. Only if the pregnant woman life is at risk, it can be done after 20 weeks. Second change in the amendment is it says simply pregnant woman. Previously, pregnant married woman was the term used, especially pertaining to contraceptive failure. Here, any pregnant woman, and she need not be married in case of contraceptive failure. Unmarried woman also can be, this abortion can be done. Then, again, pertaining to contraceptive failure, previously contraceptive failure on the part of her husband was the term. Here, now it has been changed to her partner, because now these living relationships are becoming common, especially in the urban area. Taking that into account, the progressive nature of this amendment changes her husband to contraceptive failure on her partner. So this clearly indicates these changes. This law also evolving and progressing according to the change of societal norms, as well as in destigmatization of pregnancy, it plays a vital role. There are 8 sections provided in the MTP Act Amendment of 2021, which describes various changes, like Section 3, when the duration it can be terminated, up to what weeks. Section 4 describes what are the places where MTP can be done, what are the facilities that should be available for running the MTP center, etc. Now, coming to this MTP Act Amendment, there are various indications provided. For convenience, we are studying those indications as mentioned in this MTP Act under 4 headings, like therapeutic, eugenic, humanitarian, social grounds, etc. But in the original Act, these indications are not grouped under any headings. Just for remembering these indications as well as for exam purpose, we have put these indications under 4 groups. Let us see what are these indications coming under these 4 headings. First is the therapeutic ground or therapeutic cause for this MTP. Therapeutic means when the continuation of pregnancy would involve a risk to the life of the pregnant woman, or there is a risk of causing grave injury to her physical or mental health. When the pregnancy puts the life of the pregnant woman in a grave risk of either risk to the life of the pregnant woman, or there is chance of grave injury to her physical or mental health, that is called a therapeutic indication. That is for protecting the life of the pregnant woman, it can be done. Like when the pregnant woman life is at risk, if she suffers from, for example, cardiac disease of grade 3 or grade 4, or chronic glomerulonephritis, or she suffers from intractable hyperemesis gravidarum, that is a severe prolonged vomiting, malignant hypertension, recurrent epilepsy, or severe insanity. So there is a cervical or breast carcinoma in her, or she is suffering from severe diabetes with the complications of retinopathy, or toxemia of pregnancy, that is a preeclampsia. There is uncontrolled blood pressure in the pregnant woman, generally occurs by 20 weeks. These are all some examples which may cause a risk to the life of the pregnant woman. Now coming to the second ground, that is eugenic ground. That means if there is a substantial risk that the child were born, it would suffer from such physical or mental abnormalities as to be seriously handicapped. So there is a strong evidence suggestive of substantial fetal abnormalities, either physical or mental, that may cause incompatibility to its life. Incompatible physical or mental abnormalities is detected, then for the well-being of unborn child, to prevent the child after being born to suffer from those abnormalities in this world, then it can be terminated. This is called a eugenic ground. This is done for the sake of unborn child. For example, if the mother has been exposed to any of the teratogenic drugs like warfarin, thalidomide, hallucinogens, etc., like thalidomide, an antimitotic drug, that may cause abnormal or absence of limbs or short limbs abnormalities in the fetus. Or if the pregnant woman has been exposed to radiation of more than 10 rads in the early pregnancy, like first trimester. In these conditions, there is likelihood of fetus also may be affected. Then, if the mother has contracted any of the TARS group of infections like toxoplasmosis, rubella, cytomegalovirus, or herpes, especially in the first trimester, then any gross incompatible anomalies of the fetus. The fetus is a monster, like suffering from anencephaly or any chromosomal abnormalities like Down syndrome or any severe genetic abnormalities of the fetus is detected by the radiological examination. Then parents have inheritable mental conditions like schizophrenia or chromosomal abnormalities, etc., which could have been transmitted to the unborn child. For example, if one of the parents is suffering from schizophrenia, the likelihood of transmission of this mental condition to the unborn child is around 10 to 12%. Suppose both the parents are suffering from schizophrenia, then the risk increases to fourfold, that is from 10 to 12% to 40%. Then third and important ground is the social ground. Suppose if the pregnancy has resulted from failure of contraceptive method adopted by any of the partners, either the mother or her husband or her partner in case of unmarried woman, then this on social ground it can be done. Then when a social or economic environment, actual or reasonably expected, may result in grave injury to mother's physical or mental health. Suppose severe poverty is running in the family. There are already 2 or 3 children. So upbringing of that unborn child may pose a substantial financial burden to the economic situation of the family. Then on economic ground it can be done. These two indications, either contraceptive failure or socio-economic environment, then in that situation MTP can be done on social ground. Then fourth indication is the humanitarian. Suppose if the pregnancy is caused by the rape. Rape itself causes severe mental anguish to that woman. Suppose if she gets pregnant due to rape, that will further aggravate her mental agony. So to minimize that, MTP can be done. So in that rape situation, the woman says she has been raped and coming for MTP. Doctor need not ask for her police complaint. Okay, that is one important thing. So in the social ground, as far as this failure of contraceptive is concerned, that already discussed in this amendment, it has been changed to mere woman. Previously it was a married woman. Now it has been any pregnant woman. Previously contraceptive failure on her part of her husband was the term. Now it has been changed to her partner, facilitating abortion in case of an unmarried woman. But as far as this rape is concerned under humanitarian ground, woman who has not lodged complaint once MTP approaches the doctor, as I said, MTP can be done. Doctor should not pressurize her to go and lodge the police complaint, then come for MTP. That is not required. But in the situation, woman not willing to make the complaint, Anyway, doctor's duty is to keep the police informed about the rape. Even after police counseling with the rape counselor, the woman doesn't want to make the complaint. Now that is up to that woman. Suppose woman makes the complaint, later changes mind and makes the complaint to the police, and in that situation, doctor has to preserve the products of consumption of that is aborted material and hand it over to the police for DNA profiling, that is for proving the offense as well as to this get the conviction of the particular accused based on the DNA fingerprinting. So the doctor's role here is to preserve the contents of that abortus and hand it over to the police for they will forward it to the forensic science laboratory for DNA fingerprinting to fix the accused. That will establish the identity of the accused. So this is the one important thing as far as rape is concerned. So far we have seen 4 grounds for MTP where several indications are prescribed. These 4 groups can be remembered by the mnemonic SATE, that is S for social, E for eugenic, T for therapeutic, H for humanitarian ground. Now coming to MTP roles which governs the MTP in India, consent from the pregnant woman is must. Like any other major medical or surgical procedure involving the risk to the life of the person, consent is must here. If the pregnant woman is minor, that is less than 18 years, or if she suffers from severe mental illness due to which she cannot understand the nature and consequences of either giving or opposing the consent, in that situation, in case of minor or mentally ill, written consent from the parent or guardian or the caretaker of the woman should be obtained. Should be the written consent. Her consent in the situation, consent of minor, is not valid. The woman attains majority, that is above 18 years, then she herself can give consent. The woman says she is above 18 years. Doctor in the situation should not insist on asking her to provide any document showing her age. As far as married women are concerned, whether husband's consent is required or not. Law doesn't require husband consent for MTP. Even if the husband objects also on the request of the married woman, with her consent, MTP can be done. Husband doesn't have any right as far as refusal to MTP is concerned. In spite of that, if the woman repeatedly undergoes MTP without consulting or informing her husband, or against the will of her husband, for some reason she repeatedly undergoes MTP, then in the situation the husband can file a divorce petition in the family court, and the court also may grant him a divorce under cruelty clause, because that repeated MTP without his knowledge is considered as cruelty to husband. So on this cruelty clause, MTP, this divorce can be granted to him. This is the form C, that is a consent form for MTP. This is how it looks. As you are seeing, for a case of a minor, that the consent of the parent or guardian signature is required, whereas in case of major, she herself can give the consent. Now, second rule after the consent is what is the qualification that a doctor should possess to perform abortion in India. As per MTP rules, for a registered medical practitioner, that is a doctor with the basic MBBS qualification to conduct abortion, that is those RMPs who are registered before 1971, they should have at least 3 years of experience or working experience in the Department of Obstetrics and Gynecology in any other recognized hospitals. This class has become not relevant now because several years have passed. For RMPs, to conduct MTP, they should have completed at least 6 months of house agency in the OG department, or had worked in any hospital in the department of OG for at least 1 year. So at least 1 year of working experience in any hospital where recognized MTP center is there, or 6 months of house agency in the OBG department. They can conduct abortion at any duration. Those RMPs who have at least assisted 25 cases of MTP. Out of that 25 cases, at least that RMP should have conducted 5 cases of independent MTP. He or she himself or herself should have conducted on her or on his own. That is at least 5 cases of MTP. So either assisting 25 cases, or after which at least 5 cases of independent MTP, they can conduct MTP, but only up to 12 weeks. The first time must only, not beyond that. Then class CA has been recently introduced, that is an RMP with 3 months of OBG, at least 3 months of working experience in OBG, or at least 10 cases of independent MTP. Either 3 months of working experience or 10 months of independent MTP, they can perform MTP only up to 9 weeks. That too by using medical methods, that is giving hormonal tablets only, not surgical methods they can perform, but only up to 9 weeks with this experience. As we know, any specialist in OG, either with a diploma in OG degree or a master degree, that is MS OG in the specialty of obstetrics and gynecology, they can conduct abortion irrespective of the duration. But that is 25 cases of assisted MTP, or after which 5 cases of independent MTP, they can perform only up to 12 weeks. With 3 months of working experience or 10 cases of independent MTP, then they can perform only up to 9 weeks, that too applying medical methods only. Now coming to third, after that experience, up to what period of pregnancy it can be terminated. According to MTP rules of this amendment, up to 20 weeks, MTP can be terminated on the opinion of a single doctor regarding the applicability of the particular indication as mentioned in the MTP Act. That is what we have seen under 4 headings. So up to 20 weeks of gestation, MTP can be done on the request of the pregnant woman on the opinion of the single doctor. One doctor, if he satisfies that a particular indication as mentioned in the MTP Act exists in that pregnant woman, then MTP can be done. He need not seek second opinion from another doctor. Suppose pregnancy exceeded 20 weeks, that is about 20 weeks, but up to 24 weeks of gestation. Here, 2 doctors should take the opinion regarding the applicability of the indication jointly. Here, one doctor's opinion not sufficient. He has to obtain opinion from the another doctor. 2 doctors should sign regarding the applicability of the indications. So previously, in the 1971 Act, up to 12 weeks, one doctor opinion sufficient. Now it has been enhanced to 20 weeks from 12 weeks. In the previous 1971 Act, after 12 weeks, up to 20 weeks, 2 doctors' opinion is required. Now it has been again enhanced to about 20 weeks, but up to 24 weeks. So from 20 weeks to 24 weeks, it has been enhanced. But MTP in the situation that is about 20 weeks up to 24 weeks, though 2 doctors sign is required regarding the indication, any of the 2 doctors can perform MTP on the woman. It is not that 2 doctors together should conduct. Any of them can conduct a MTP. If the pregnancy exceeds about 24 weeks, as I already told, here the only indication is there should be a substantial fetal abnormality. If that case exists or not, to find out that, then the opinion of state level medical board should be obtained here. So the pregnancy more than 24 weeks, as it crossed that latest becomes a later stages of pregnancy, there is a high risk of conducting MTP on that advanced period of gestation. Surgical interventions is required here. So, to assess that pregnant woman whether she is physically fit or that existence of that only indication like substantial fetal abnormality is there, only on that ground it can be done. So for that a state level medical board permission is required. The woman has to make the requisition to the state level medical board comprising a gynecologist, pediatrician, radiologist or sonologist, and any other member or specialist, either one or more members that is nominated by the state government. The names of those doctors are being nominated by the state government depending on the case. So state level medical board permission is required. There are mainly three specialists: a gynecologist to assess the well-being of the pregnant woman, if she is physically fit or not; a pediatrician to confirm what abnormality, a physical or mental abnormality that is affecting the child; then radiologist or sonologist to diagnose that fit abnormality, and any other specialist depending on that case. So this is the state level medical board. So as far as this state level medical board, which form opinion when the pregnancy exceeds about 20 weeks, their duty is to first examine the woman and going to scrutinize all her reports, medical reports. Then based on that, they have to provide opinion whether they allow or deny MTP, that is provided in the form D. Suppose if they allow MTP beyond 24 weeks, then they have to, it is a duty of the state board to find out, uh, to ensure whether all the safety precautions are being followed as far as procedure is concerned. Then in case of denial and all, counseling has to be given. Then they have to ensure within 5 days of receipt of request for MTP that MTP should have been done on that pregnant woman. It's not beyond that. They cannot prolong this time for giving approval, etc. It is a duty of the medical board to confirm that within 5 days of a request from that pregnant woman, then they have to examine her, scrutinize her reports, and in case they allow MTP, then it is a duty of that state medical board to confirm that MTP has been done within 5 days. So within 5 days of request made, it is that MTP should have been done as per this amendment. Now coming to indications for MTP up to 20 weeks. This is how the indications for MTP are provided in the MTP Act. As I already said, for convenience we have grouped these indications into various headings. Let us see up to 20 weeks where MTP can be done with the opinion of single doctor. What are all the indications? These are all the indications as we have already discussed under 4 headings, like danger to life, grave injury to physical or mental health of pregnant woman, coming under all these coming under therapeutic, pregnancy caused by rape, like the humanitarian ground, then fetal malformations that are incompatible with life, that if these malformations are expected by after radiological investigations, etc. Then that is a eugenic ground. Then failure of any other contraceptives that we already discussed under social ground. So this is how the form 1, where pregnancy up to 20 weeks with the opinion of single doctor, only one signature is required here, MTP can be done. Then in case of pregnancy exceeding 20 weeks up to 24 weeks, where as we have seen, opinion of 2 doctors required regarding the applicability of the indications. So what are the actual indications in the MTP rules? That is, the pregnant woman is sanitary to rape or incest of the pregnancy results. Incest means the man and the woman, they are in the prohibited degrees of relationship. The pregnancy occurs. like intercourse between the father and daughter, or a male and with his aunt. In that situation, prohibited degree of a relationship, which is considered not acceptable legally outside the laws. Then vulnerable group of women. Vulnerable women are those like minors, children, differently abled women, physically handicapped women, mentally ill women including mental retardation. These women are considered as a vulnerable women. So if they become pregnant, MTP can be done even beyond 20 weeks. This vulnerable class is important in the recent amendment. It has been included. Then change of marital status occurring in the pregnant woman during the ongoing pregnancy. Suppose a woman turns a widow, or she become divorced during the ongoing pregnancy, then to minimize the mental anguish, then MTP can be done. If there is substantial fetal malformation that are incompatible with the life, then MTP can be done. On humanitarian settings or disaster or emergency situations as declared by the government. This is the Form E, that is opinion of two RMPs about 20 weeks up to 24 weeks, where two doctors should sign the form here, where any one of the doctors can perform abortion. Now, the pregnancy crossed even after 24 weeks, then as we have seen already, this state level medical board decision is a must. They can either allow or deny. Here the only indication is there should be a fetal malformation that has substantial risk of incompatible with life. Or if the child is born, it may suffer from such physical or mental abnormalities so as to be seriously handicapped. Again, that is incompatible with life. Only the only indication beyond 24 weeks. Not even minor victims, minor rape victims or minor women, they cannot undergo abortion. Even in this amendment also, that rape class has not been included, the pregnancy exceeded after 24 weeks. Only in case of fetal malformation it can be done. Again, in this situation, to get the abortion done, especially by minor rape victims or any rape victim, they have no other option except to approach the High Court or Supreme Court for only it is now a court decision only can allow. This is how the Form D looks, where the report of the state medical board. So as you are seeing here, this is allowed or MTP is denied after the inspection and of the physical examination as well as the scrutiny of our reports. The places where MTP can be performed. The rules prescribe what are the requirements for running the MTP center and where it can be done. MTP can be done in a hospital established or maintained by the government. So any MTP center established or being maintained by the government, that is government hospitals where the MTP centers are running, it can be done. For a place approved by the government, that is a private clinics or a private hospital who want to run the MTP center, then they have to procure license from the district level committee headed by the chief medical officer of the district or district health officer as the chairperson of the said committee. So they have to procure license from the district level committee. Without license, that private clinic or hospital cannot run the MTP center. So the district level committee comprises minimum 3, maximum 5 members, including a chairperson as one of its member. So they will come and inspect, and they are satisfied with the required facilities, they can give license. So even for RMPs with the necessary prescribed experience who are not having diploma or master degree in the OG, for RMPs to perform MTP, as we already discussed that necessary experience, they have to obtain the certificate from that MTP center and they have to apply to the district level committee. Then again these RMPs also to conduct MTP, they have to procure license from the district level committee. Like for running the MTP center, if you are not a specialist in OG, then you have to again procure license from the district level committee. Now coming to these rules, so far we have seen which describes various experience, that is requirement for places, etc. In case of emergency, in order to save the life of the pregnant woman, if the pregnancy poses a imminent danger to the life of the pregnant woman, then to protect her life, any RMP need not be a specialist or need not be a doctor having the prescribed that necessary experience as mentioned in the MTP rules. Any RMP even without required experience can perform MTP at not only any recognized place, at any place, irrespective of duration of gestation, even after 20 weeks or 24 weeks also, to protect the life of pregnant woman, then it is allowed. She won't be, he or she won't be punished as per various sections of Indian Penal Code. So that is one exemption. Okay. Only indication here is that primary aim is should be to protect the life of the pregnant woman in case of emergency. Then he won't be punished as per MTP Act. So what are all the requirements for MTP up to 12 weeks for getting the permission for running the MTP center, especially in case of private hospitals or private clinics? So for MTP up to 12 weeks, that Act describes that place should have a labor table, resuscitation and sterilization equipments, then basic drugs and parenteral fluids, then drugs for treatment of shock, like IV fluids, this atropine, adrenaline. These basic drugs should have been there, emergency drugs. Then facilities for transportation. Any emergency occurs, to transport the complicated abortion patient to nearby higher centers. Like so, ambulance facilities like that should have been there. So this district level committee will come and inspect for whether all these facilities are available. Then accordingly, they will give permission. Then, if you want to run the MTP center where you have to conduct above 12 weeks, that is beyond first trimester up to 24 weeks, then what are all the facilities, minimum facilities required? Here, that place should have an operation table and instruments, that is an OT with basic instruments and operation facilities for doing any gynecological surgeries. Then anesthesia, again, so this OT and anesthetic facilities should be there, anesthetists should be there, uh, all the equipments for anesthesia, resuscitation and sterilization equipments in case of emergency, resuscitation facilities like cardiopulmonary resuscitation, the DC shock, all these facilities should be there. Then drugs and parenteral fluids for emergency use notified by the government of India from time to time. Now, requirements for MTP beyond 24 weeks. Here, in addition to this, what we have seen between 20 and 24 weeks, here that is 12 to 24 weeks. Here, in addition to this OT, anesthetic equipment, sterilization equipment, resuscitation equipment, blood transfusion facilities, etc. Main facility here is there should be facility for surgical procedure under ultrasound guidance. Ultrasound guidance aided surgical procedures, that facility should have been there if you want to run the MTP center, which can take the cases beyond 24 weeks. This is the Form A, application for approval for running the MTP center. This is how the application should be made to the district level committee. And this is the form after inspection that district level committee that they provide license. This is how it looks. Certificate of approval. Depending on the facilities, they are up to 12 weeks or up to 24 weeks or beyond 12 weeks, it can be given. Maintenance of register under MTP rules, that register has to be maintained by the head of the hospital. The register means that book that carrying basic details of the MTP, that pregnant woman, like her name, address, her consent, what is the procedure adopted, what is the indication for MTP done. All the details should have been recorded in the MTP register by the head of the hospital, and that also has to be maintained for at least 5 years from the date of MTP procedure or the surgery done. Minimum 5 years it has to be maintained. And as far as maintenance of this register is concerned, it has to be maintained secretly without vision of anyone. The doctor's duty is to keep it as a secret document. And professional secrecy should be maintained as far as MTP that patient is concerned. Doctor should not reveal the name and other particulars of that woman who has undergone MTP to anyone other than the persons authorized by the law. Only to the persons authorized by the law, doctor can reveal the information like her name, any details of the MTP that patient to whom he has conducted the procedure. So it should not reveal to any person, even to the family members of the pregnant woman or the close relatives. Whoever asks or demand the details, it is the doctor should not reveal it unless authorized by the law, or only to the court or to authorized persons by the court. Then only the doctor can reveal it. If the doctor reveals this information to unauthorized persons, then contravening this professional secrecy will attract punishment of 1 year imprisonment or fine or both. In the 1971 Act, punishment is just a fine of 1,000 rupees only in case of contravention of professional secrecy. In this amendment, 1 year imprisonment is included. It is considered as a serious offence, not maintaining the professional secrecy by the doctor. So according to this MTP Act, the violation of it constitutes imprisonment for up to 2 to 7 years imprisonment is there. Any doctor or any person whoever violates the MTP Act performing in violation to the indications as well as various rules so far we have seen, not following these rules, whoever does MTP like without any indication he is doing, or in a not place he is doing, or without required experience or qualification as mentioned in the MTP rules, that what we have discussed so far, conducting abortion without any emergency. In the elective MTP case, is unqualified these doctors are conducting MTP in an unrecognized or not approved place, then they are punishable from 2 to 7 years imprisonment. That too rigorous imprisonment, that is rigorous means hard labor. Not only the doctor who is conducting abortion in unauthorized or unapproved place, that owner of the place who let out the place to the doctor to run the MTP center, he also punishable the same imprisonment of 2 to 7 years. That we must know these things. So these are all the major differences for this MTP Act amendment from the original MTP Act of 1971. That and all we already discussed. That is 71 applies only to married women, especially this contraceptive failure class, social class we have seen. Here even unmarried woman on the ground of contraceptive failure, it can be MTP can be done. So only up to 20 weeks for all indications unless there is emergency as per 1971 Act. Here up to 24 weeks it can be done in case of vulnerable woman, rape victims, incest, all these from 20 to 24 weeks. This amendment again allows MTP beyond 24 weeks also in case of substantial fetal, physical or mental abnormalities. That is one important that progressive change. One RMP only opinion is required up to 12 weeks. 2 RMPs joint opinion is required beyond 12 weeks up to 20 weeks. That is as per 1971 Act. In the amendment, 1 RMP period is enhanced from 12 weeks to 20 weeks. Then 2 RMPs from 20 weeks, it has been enhanced to 20 to 24 weeks. Medical board approval beyond 24 weeks. That is important. This is the amendment. Medical board has been included. Medical board, as I told, essentially comprises 3 specialists. a gynecologist, a sonologist or radiologist, as well as a pediatrician. Then, breach of women's confidentiality, that is contravening professional secrecy, 1971 Act, just a fine of 1,000 rupees only. This amendment provides, in addition to fine, there is a risk of imprisonment of up to 1 year. So these are all the main major differences between the amendment as well as the 1971 Act. Now coming to next important concept of this today's topic, that is various IPC sections, Indian Penal Code sections governing criminal abortion in India. What are all the punishments for criminal abortions as per these sections? As per section 312 IPC, the abortion can be done only to save the life of the pregnant woman. Abortion done for any other indication would attract this section, that is section 312 IPC. Here, whoever does criminal abortion with the consent of the pregnant woman, then they are punishable under this section. Not only the abortionist, suppose the woman herself attempts abortion, as now becoming common, seeing the YouTube videos conducting abortion or pregnancies, then complications because of that, the pregnant woman may die. In this situation, woman herself attempts abortion. If it fails, then it is the woman also punishable under this section. Not only abortionist, attempting abortion herself is punishable. Pregnant woman is punishable. Suppose MTP is done before quickening occurs, the imprisonment is 3 years or fine or both. The MTP done after quickening stage, it is 7 years and fine. Quickening or quick with the child means that stage of quickening has occurred in the pregnant woman. Quickening means first perception of that fluttering intrauterine movements by the pregnant woman. First perception of fetal movements by the pregnant woman is called quickening, which normally occurs between 16 and 20 weeks of gestation, that is from 4th to 5th month of gestation. So the pregnancy is terminated illegally before 16 to 20 weeks, before attaining quickening, imprisonment is 3 years. After that period, say after 5 weeks, then imprisonment is enhanced. It is considered as a grave offense, so imprisonment also up to 7 years or fine, and fine should be imposed. So as per section 312 IPC, criminal abortion is done with the consent of the pregnant woman, and woman who attempts herself abortion also punishable. With the consent before quickening 3 years. Suppose MTP done with the consent, but after quickening period, after 5 months the gestation crossed, the punishment is 7 years fine. This section, this provision can be remembered by first letter of 312 IPC. 3 means that consent, C means consent, that is third letter, then 3. 312 represents before quickening 3 years. So punishment starts from 3 years onwards. 3 years, 7 years, 10 years, life imprisonment. These numbers you should be familiar as far as this section 312 to 316 is concerned. 3, 7, 10, life imprisonment, that is 14 years. Coming to next section 313 of IPC governing punishments for criminal abortion. Whoever does criminal abortion except the classes we have mentioned, like except to save the life of the pregnant woman, without consent, the abortion is done against the provisions of criminal abortion, provisions of MTP Act of this amendment 2021. It is considered as a criminal abortion only. So conducting criminal abortion without the consent of the pregnant woman, the punishment is 10 years or life imprisonment also, irrespective of whether quickening has occurred or not. Life imprisonment means 14 years. So with the consent, either 3 or 7 years, whether quickening, before quickening or after quickening respectively. Whereas without consent, whether quickening or after, irrespective of duration of gestation, minimum 10 years to life imprisonment will be given. So consent is important role without consent here. Again, the last number, see hereafter the last number is important to remember the provisions here. 3 represents C without consent. And if you add 3 plus 7 also, here 10 years to life imprisonment, that can be remembered. 3, 7, 10, 14. Then next section 314 Indian Penal Code. Here, due to criminal abortion, apart from death of the unborn child, death of the woman also, pregnant woman occurred. The abortionist has caused some injuries to the pregnant woman, leading to death of the pregnant woman due to the method adopted by any means, whether due to poisoning or injuries. The death of the pregnant woman occurs in addition to abortion. Here, the consent of the woman was obtained prior to criminal abortion, then 10 years plus fine will be awarded. If there was no consent for abortion, then 10 years to life imprisonment can be given. Here, with consent, 10 years. Without consent, conducting criminal abortion, 10 years to life imprisonment. This class can be remembered by 4, that last number represents the 4th letter, D for death of the pregnant woman. Then section 315 IPC says, whoever causes any act to prevent the child being born alive or to cause it to die after birth, either killing a child in utero during the process of labor or killing a live born child, they are considered as causing criminal abortion if it is done against the provisions of MTP Act. Here the punishment is 10 years or fine or both. How it differs from section 312 or 313 is, here the duration of gestation is above the age of viability. So above the age of viability, that is above 28 weeks, the pregnancy has crossed, the death of the unborn child occurred prior to delivery or during or after delivery, or causes the death, then instead of 312 or 313, as it is becomes a viable child, that is as I told, viable child means survival, capable of survival, that child after birth. So the child that is supposed to survive after the birth, that is called a viable child, is 28 weeks. More than that, then that punishment has to be given according to 315 instead of 312 or 313. Then section 316 is the primary aim was to kill the mother, but the death of her quick unborn child, that is after this 16 to 20 weeks, quick unborn child is caused. She remains unharmed. So primary aim of that culprit is to kill the mother, whether instead of mother get harmed, death of the weak unborn child has been caused. Abortion occurred. In the situation, punishment is 10 years or fine. Like suppose a person in this picture, he kicks the pregnant woman. Suppose she is not much harmed, but due to that blow on her abdomen, death of the unborn child occurred. Then that person will be punished up to 10 years along with the fine. Here the section 316 applies. So previous section 315 can be remembered by that last number 5 for V. V for viability. Roman letter V for viability. 5V viability can be remembered. Here 316, that can be remembered, that 6 number that corresponds to 6 letters in the mother, 6 letters in the unborn. Mother, unborn, 6 letters, 316 IPC. And if you sum up 316 also, 10 years, that punishment number also can be remembered if you add 316. Then lastly, section 511 of Indian Penal Code, that says failed attempt. Now all the above sections, that is 312 to 316, the person fails in his attempt to cause abortion. Abortion has not occurred, but only at least attempted criminal abortion. Child has survived. In the situation, half of the imprisonment for having attempted the criminal abortion, unsuccessful criminal abortion, still is he won't be let out. He will be punishable under 511 IPC with half of the punishment prescribed in the relevant sections. According to section, whether it is 312 or 313 or 314, if he comes as per the provisions of the Act, if that offence comes, in case of a failed attempt where the child survives, then the abortionist will be provided punishment of half the imprisonment that has been mentioned in the relevant section. Suppose 10 years has been mentioned in that section, then for just 5 years will be awarded for the failed attempt. So this is the easy representation of these sections 312 to 314. 312 consent is there, but not quick, 3 years. Quickening occurred, 7 years. 313, whether quickening or not quickening, consent, without consent, okay, that is 10 years. Whereas section 314, again here death of the pregnant woman occurs, that fourth letter D for death of the mother occurs, whether quickening or not. Whether, suppose if the consent was there, 10 years. Without consent, death of the woman occurs, 10 years to life imprisonment. So 312, 13, 14, 315 and all, as we have seen, 5 letter is the 5 for V, that is a viability. That is, after attaining viability, section 315 comes here, criminal abortion leading to death of the child. So 12, 13, 14 before that, 315 after that, after viability. 316 that I already told, 316 is for unborn child. Primary aim was to kill the mother, she remains unharmed, but death of the quick unborn child occurs. 6 for 6 letters, unborn and mother. Now coming to another important concept in this today's topic, that is methods for procuring or inducing criminal abortion. What are those dyes, that is traditional birth attendants or quacks, they will employ? What are the methods they will employ pertaining to duration of gestation? In the first month, the woman is not sure of she is pregnant. She shows some vomiting, nausea sensation, so she believes that she has been pregnant, but there is no mystery period. Then in the situation, they will prescribe, the abortionist will recommend any violent exercises, alternate hot and cold baths, purgatives, etc. Suppose mystery period is there, almost she has certain that she has become pregnant, then they may try abortifacient drugs. The pregnancy exceeded 2nd month, from 3rd month onwards till delivery, then these drugs won't work out. Then mechanical interference, some surgical methods and all they will employ. Mechanical interference by any means they will employ. Now coming to mechanical violence, which is being applied in the first month of pregnancy in case of doubtful pregnancy, they will prescribe direct violence, that is directly acting on the uterus, or indirect violence, which are believed to cause abortion, but most often these violence methods are not fruitful. Mostly they will be unsuccessful in inducing abortion. Like direct violence includes receiving kicks or blows by the pregnant woman on the lower abdomen, kneading or massage, severe massage or kneading or kneeling on the abdomen, lower abdomen, etc. Severe massaging of the uterus through abdominal wall, or applying tight bandage on the lower abdomen like that. Then a special method of direct violence often employed in the relatively later stage of in this first month is the cupping. That is, a flaming light is placed on a lighted wick is placed on the hypogastrium, lower abdomen. Then that a metal bowl or a mug is inverted over that lighted wick. What happens is that air inside that bowl that expands due to the heat by the lighted wick, and it escapes through the mouth of the inverted mug. Then as the heated air escapes, on cooling the remaining air contracts and part sits tightly on the abdominal wall due to the vacuum produced by inside the mug. So mouth is tightly held over the abdominal wall in the lower abdomen. Now when the tightly held part is suddenly pulled upwards, that abdominal wall along with the anterior uterine wall is stretched forward. That also pulled forward along with the mug. Abdominal wall as well as the anterior uterine wall. As the uterus is being pulled suddenly upwards, the underneath the placenta that gets separated, then that will cause to spontaneous expulsion of that contents of uterus, leading to abortion. So that embryo and all, it is believed to get expelled by this method. This method, as the metal cup is used, it is called cupping. This is an important exam question. Cupping is often asked viva or theory question. Coming to indirect violence, not with a direct impact on the uterus like kicks or cupping, etc. Indirect violence includes like carrying or lifting heavy weights. This is believed to induce abortion. All these methods, whether direct or indirect violence, how far they are successful is questionable. Often these will fail only. Cycling on jumpy or bumpy roads, driving over rough roads, horse riding, jolting, jumping from a height, skipping, running upstairs and downstairs fastly. All these are supposed to be employed in the first month of pregnancy, coming under mechanical violence. This is how the cupping is being done. See, as you are seeing, was lighted wick inverted metal that mug is placed, which is tightly placed, and when they suddenly pull out, that tightly held mug will separate the anterior uterine wall, which will cause a detachment of the placenta from it, leading to abortion. That is, the heated air escapes and vacuum is produced inside. That will cause the mug to tightly hold over the lower abdomen. So sudden pulling lead to separation of placenta and expulsion. This is called cupping. Second is the method is the abortifacient drugs for criminal abortion, that is employed in the second month of pregnancy. When this general violence won't help, they may go for abortifacient drugs. Abortifacient drugs may be either directly acting on the uterus. The site of action is on the uterus. They may cause abortion. Indirectly acting on the uterus drugs, that is not direct action on the uterus, they act on the other systems of the body, thereby provoking uterine contractions by reflex mechanisms. They are called indirectly acting abortifacient drugs. So abortifacient drugs means those drugs causing abortion. So coming to directly acting abortifacient drugs, that means acting directly on the uterus, there are two types. One is ecbolics, other types is immunogags. Ecbolics means, that comes from the Greek word ek. Ek means away from, balin means through. That is, they cause abortion by increasing the uterine contractions, thereby leading to expulsion of uterine contents. They are called ecbolics. Ecbolics are those drugs which cause severe uterine contractions, otherwise called oxytocics, like oxytocin, and they promote uterine contractions leading to expulsion. Most common and most important ecbolic being used by the criminal abortion is the ergot. The side effect of this ergot drug is they produce a profound arterial spasm leading to gangrene of extremities, etc. Then synthetic estrogens, pituitary extract, strychnine, quinine, they are all also examples for ecbolics. Coming to immunogags, how they differ from, though the site of action is on uterus like ecbolics, they differ from ecbolics by their mechanism of action. These drugs will cause uterine congestion, severe uterine congestion leading to increased menstrual flow, increased bleeding. So by that way they cause expulsion of products of conception, not by promoting uterine contractions. So immunogags increase the menstrual flow. Examples include estrogens, borax, savin, sanguinarine, etc. Estrogens, borax, these are all commonly used immunogags. So ecbolics and immunogags are very important terms. You should be familiar. Both act directly on the uterus under abortifacient drugs. Coming to acting on other systems, thereby indirectly stimulate the uterine contractions are the GI irritants. They cause inflammation of GI tract when they enter the body, thereby cause the reflex uterine contractions. That's all. Like severe tartar emetic, they produce severe emetics or vomiting. Strong purgatives like castor oil, croton oil, saline purgative like Maxulf, etc. They cause severe inflammation of GIT, promoting reflex uterine contractions and expulsions. Similarly, genitourinary irritants, they cause inflammation of genitourinary tract like oil of turpentine, oil of tansy, cantharides, potassium permanganate crystals which are applied through vaginally as a form of paste, etc. So that cause inflammation and irritation of urinary tract leading to uterine contractions. Then systemic poisons. At sublethal doses, the drug may be lethal to drug fetus, but sometimes may cause harm to the mother also. The dose exceeds. By giving some systemic poisons in the minimal doses, that is sufficient to cause the death of the fetus. Sometimes overdoses may lead to poisoning of the mother also. So she may also die due to poisoning apart from the fetus. Inorganic metallic irritants, they are generally given under systemic poisons like a salt of heavy metals like lead, copper, antimony, mercury, etc. These inorganic metallic salts, they are used as a systemic poisons. So they, when given in sublethal doses, that will cause a fetal death. Then organic irritants like bark of Plumbago rosea plant, juice of calotropis, that madar plant, seeds of carrot seeds, unripe fruit of papaya or pineapple when consumed by the pregnant woman, unripe papaya or pineapple, they will cause this abortion by their systemic action. So this is the ergot, that is the common and most common ecbolic being used. Then borax, that cause menstrual flow in comparison to ergot, which cause uterine contractions. This is the castor oil under GI irritant, inflammation of GIT, reflex uterine contractions. Oil of tansy, that is a genitourinary irritant, cantharin. These are all genitourinary irritant, inflammation of urinary tract, promote reflex uterine contractions. Under systemic poisons, this is the calotropis plant. As you are coming in that broken stalk, that one gives rise to a white milky juice. That is being applied through abortion stick, etc., are given to the pregnant woman. That may cause a fetal death. Then unripe papaya or unripe pineapple. These are all organic systemic irritants. Now coming to these local methods which are employed in the advanced stage of pregnancy, especially in the 3rd or 4th month, they will apply various mechanical methods like introduction of abortion paste, especially fetex paste that is commonly used, or uterus paste made up of potassium iodide, thymol or mercury, or lead oleate paste. These are all through abortion sticks, they will be introduced into the uterus. Abortion paste application. Then abortion stick that is introduced into the uterus along with using this paste or various juice of calotropis or some other chemicals, they will introduce using the abortion stick into the uterus. That could cause uterine congestion, inflammation, and leading to reflex uterine contractions causing abortion. Then laminaria tent, otherwise called a seat angle tent or slippery embark, that is inserted into the cervix. Whereas abortion stick is introduced into the uterus, generally it is placed in the cervix, that will cause a dilatation of cervix. Curettage, like a dilatation and curettage conducted by that is skilled abortionists, they will also do this. Scraping of inner uterine wall. Then rupture of membranes, like artificial rupture of membranes employed in the MTP, that will cause uterine contractions. Introducing metal rods and knitting needle or any sharp long objects like ribs of the umbrella, hairpin, any other long iron rods. This can be introduced to cause the rupture of membranes. Then syringing using Higginson syringe or enema syringe aspiration, air insufflation into the uterus by syringe or pumps. This are all syringing or air insufflation is that is air or fluid is introduced into the uterus under high pressure. They are believed to uh, detach the placenta and amniotic membrane from the uterine attachment, leading to expulsion of the that fetus. But complications here is the syringing or this air insufflation that will cause air embolism, or the soap solution is used for syringing, soap embolism, fat embolisms that may cause death of the pregnant woman. Electricity, low voltage electricity, that is a negative pole is placed in the cervix or posterior cul sac of vagina, or and a positive pole over the lumbosacral region, and a low voltage electric current like 110 volt electric current is applied through the positive and negative poles. That one is placed over the cervix and other is placed over the lumbosacral region. That will cause uterine contractions and abortion. This is abortion stick. This is the abortion stick as we are seeing here. The abortion stick is generally 12 to 18 centimeter long, where one end is wrapped with a cotton or a cloth, and this one is will be dipped in the paste of lead oleate or arsenious oxide, or juice of semicarpus anacardium, that is marking nut, or any calotropis juice, any irritant. After soaking that irritant with that cotton wrapped over the a bamboo or any wooden stick. It is generally made of bamboo stick, 12 to 18 centimeter long. So after soaking in the irritant, that is inserted into the uterus. Due to that chemical or irritant juice, that is either that lead paste or any of the poisons, that will cause congestion and inflammation and irritation of uterine walls, leading to that beginning of uterine contractions. Severe uterine contractions occur, leading to expulsion of fetus. As you are seeing in this, it is introduced into the uterus. This is the abortion stick. Often it comes in the exam. What is abortion stick? What are the chemicals being used for it? That is marking nut juice, otherwise called semicarpus anacardium, juice of calotropis, a paste of Abrus purgatorius, or salts of any heavy metals like lead or lead salts or any arsenious oxide, that paste. Anything can be introduced, any irritant, using this abortion stick. Careful insertion may lead to injury to the vagina, cervix, or sometimes even perforation of uterus occurs if the stick is introduced too deep, leading to hemorrhage and shock in the pregnant woman. Then, slippery embark or Almus falvati, that is from the inner bark of this tree, which is grown in Central America or North America. That inner bark, that is placed similar to laminaria tent in the cervix. It absorbs water, it swells as it increases in size. It absorbs water from the cervix, So as it swells up, that will in turn dilates the cervix, leading to expulsion of products of conception through the dilated cervix. This is the Higginson syringe. Always enema syringe also can be used. One end is dipped in water, other end is that placed inside the cervix or uterus, and that pump is pressed. So the water from the container will be forced into the uterus. So inner that into the ass of the uterus, that other tip is placed, and that water is forcefully injected into the uterus, that causes the placenta separation and expulsion. A syringe with the cannula attached, manually that vacuum is created by use of a large syringe like this. That cannula is inserted in the uterus. As the syringe is pulled, that vacuum created will cause the separation of placenta from the uterine walls and leading to expulsion. As well as that fetal contents also, that embryo also can be sucked out using the syringing like this. So creating a negative pressure inside the uterus for aspirating the uterine contents. That is called syringe aspiration. This is the rupture of membranes using the knitting needle or any coat hanger, or any other sharp instruments that is introduced leading to rupture of membranes. Usually when the membrane rupture occurs, generally we can expect a spontaneous expulsion beginning of labor uterine contractions within 24 hours. This is the laminaria tent, otherwise called a sea-tangle tent. It is prepared from the stalk of that marine plant called a laminaria digitata, that I call a type of seaweed. So when these laminaria tents are available in various diameters, generally they are around some 5 to 10 centimeter in length and 0.5 to 1 centimeter in diameter, and it is placed inside the cervix. This laminaria tent, otherwise called a sea-tangle tent, that absorbs water from the cervix, so that it gradually swells up as it is retained in the cervix for some hours. So when it swells up, increases in diameter, that in turn causes the corresponding increase in the cervix also. Okay, so it opens up, it dilates the cervix, facilitating the abortion. Spontaneous expulsion occurs and to dilated cervix. That is, so laminaria tent is placed in the cervix. Same mechanism of action for slippery embark also. Slippery embark, that what you have seen from that American tree. That also the action is same. So these are all the various methods of abortion, criminal abortion, pertaining to their site of action. We have seen like purgatives act on GIT, GI irritation, ecbolics act on uterus causing uterine contractions, direct violence on the lower abdomen may cause separation of placenta, etc., leading to expulsion, or instrumentation into the cervix or uterus like abortion stick, rupture of membranes. And these are all the various methods according to the sites of action. Coming to methods, medical methods of MTP. According to the duration of gestation, different methods are employed. Like in the beginning, when the first trimester, prostaglandins, menstrual regulation, vacuum aspiration, mifepristone and methotrexate, that work out up to 9 weeks. These are all the methods generally employed. Then beyond 12 weeks or in the late stage of first trimester, DNC, dilatation curettage, dilatation evacuation, intramorganic hypertonic saline or urea solution or prostaglandins. Then the later stages of pregnancy, then dilatation and extraction, and the most advanced stage, hysterectomy, which is similar to cesarean section, is being employed. So these are the general methods by the skilled abortionists or professionals who are conducting MTP as per MTP rules. These are the medical approved methods, medical and surgical methods being approved for conducting MTP. These are the commonly used methods, like drugs giving like mifepristone, misoprostol, DNC, that is generally called dilatation and curettage, that is being replaced now by vacuum aspiration technique or surgical abortion because of minimal complications compared to dilatation and curettage. Dilatation followed by oxytocin infusion. As you know, oxytocin will promote uterine contractions. Dilatation and evacuation. In contrast to dilatation and curettage, dilatation and evacuation is employed in the later stages of pregnancy, where the fetus become well grown, which cannot be taken out by vacuum aspiration. So it has to be dismembered and evacuated. That is called dilatation and evacuation. Intraembryonic instillation of prostaglandins, especially prostaglandin E2 or F2 alpha, they are commonly used. That will cause uterine contractions. Then extraembryonic instillation of hypertonic saline, that will cause a fetal death. Hysterectomy. These are all the methods based on the duration of gestation in the ascending order. We can apply these methods. So initial 9 weeks of gestation, these hormonal pills will be effective. Mifepristone alone will be effective up to 72 hours. Beyond that, up to 9 weeks, a combination of mifepristone as well as misoprostol is often used. So mifepristone is the this anti-progesterone. This progesterone is normally secreted this by ovaries. That's role is to uh, protect the lining of the uterus. Okay, as it keeps the lining of the uterus, so therefore this embryo is well attached there. This is the mifepristone, that is the anti-progesterone. It blocks the progesterone receptors, thereby preventing the action of progesterone. So what happens is, because of the progesterone receptors are being blocked by this mifepristone, that inner lining of the uterus gradually becomes weak. There will be a degeneration of that inner lining occurs, leading to detachment of embryo, and abortion happened here. So initially the pregnant woman, tablet of mifepristone. This is available as MTP kit with 1 tablet of mifepristone 200 mg and 4 tablets of 200 microgram each of misoprostol tablets. So first, mifepristone 200 mg is given. It is anti-progesterone. It causes the detachment of the embryo by weakening the inner lining of the uterus. So it weakens the decidua, causes the detachment of embryo from the inner lining. So after 48 hours, the expulsion doesn't occur by that time. After 48 hours of giving this mifepristone tablet, we have to give 4 tablets of misoprostol 200 microgram each. That causes, similar to this one, like oxytocin, uterine contractions, as well as it causes dilatation and softening of cervix. Softening of cervix, dilatation and uterine contractions, this misoprostol, that is nothing but that prostaglandin analog, especially prostaglandin E2, that promotes uterine contractions and expulsion of that detached embryo or that fetus that will occur. But these drugs should be given only under medical supervision, not for prescription or over-the-counter drug, because these drugs will cause severe side effects like excessive bleeding, leading to risk to the life of the pregnant woman. So only under supervision it has to be given, provided the doctor is having a necessary experience, or the specialist only, preferably it has to be given. Then these are Higas dilators, which are of different diameters. They are placed inside the cervix after lubricating. After applying lubricant, that have to be inserted into the cervix, and from in a smaller size to bigger size for dilatation of the cervix for facilitating abortion. Then oxytocin can be given after this. Or uterine curette. This is the curette after obtaining necessary cervical dilatation. Then curettage, that is scraping out of inner uterine contents, can be done using this instrument called a curette. So this is how the dilatation and curettage, simply DNC, is being done. So vagina is opened using the speculum placed in it. Then that cervix is dilated by introducing Higas dilators of different sizes. Then after obtaining necessary cervical dilatation, then that curette is introduced into the uterus. Then uterine contents from the inner wall of uterus should be smoothly or gently scraped out using the curette. Complications are with the dilatation curettage, a careless handling of this curette may lead to uterine perforation and severe intraperitoneal bleeding, hemorrhage, leading to hemorrhagic shock in the pregnant woman. So this is how the curette is done. So, and we have to ensure all the products are removed. Any retained products are there, that incomplete abortion like that, then that will cause delayed complications like severe uterine bleeding or septicemia in the pregnant. This is a cerviframe gel that is applied in the cervix, that will cause that expulsion, uterine contractions. This is similar to, this is nothing but that prostaglandin gel only, prostaglandin E2 like that. Then oxytocin injection, that will cause uterine contractions, that has to be given as slowly the IV drip oxytocin, that will promote uterine contractions like ecbolics we have seen under abortifacient drugs. This is a vacuum aspiration technique that is currently replaces this vacuum, this DNC, because the curettage there is a risk of perforation, injury to the cervix, all these. This vacuum aspiration technique is more commonly used because of the relatively safer technique. Here a vacuurette, instead of that curette, here the vacuurette, a vacuum, that one. That is, the vacuum is established, introducing the vacuurette into the uterus. Due to the vacuum, that contents are that are expelled. See, this is how the vacuum aspiration abortion followed by curettage is being done. So after vaginal opening is obtained, introducing the speculum and vaginal speculum, then holding the cervix using that clamp or tenaculum, then this vacuurette is introduced into the uterus, similar to that vacuum remover, we are using in the house. Similar to that vacuum suction pump, using that vacuum is created inside the uterus. Because of that vacuum, the contents of the uterus, that embryo, that fetus products, they are removed and collected inside the jar, collection jar. It is suctioned out. The placenta also removed. Placenta, embryo, all these uterine contents are removed by the suction. It's collected in the suction, that jar, collecting jar. So after this vacuum suction, that curettage, if necessary, should be done using the curette. Whatever still left over, that products of conception, even after vacuum aspiration, that has to be removed. So we have to ensure no other part, that abortion is complete after this vacuum aspiration. A gentle curettage can be done to remove that retained products still. So this is the vacuum aspiration abortion is generally done in the first trimester for replacing the dilatation and curettage. Dilatation evacuation, suppose the fetus becomes well grown, then it cannot be removed by the suction using the vacuum aspiration. Then dilatation and evacuation abortion, D and E is done in the later stages. Here a plier like instrument, or this one, a large cannula, that is in clamp like that is introduced into the uterus. Using that plier like instrument, all the body of the fetus is dismembered, fragmented into pieces, like rims are cut and they are pulled. Similarly, spine is crushed, that trunk is crushed, then head also crushed and taken out. So using that clamp like that instrument, that fetus is grasped, it is dismembered, it is mutilated, and it is removed one by one. As the fetus is larger now, it cannot be taken as a whole using the vacuum aspiration. So dilatation and evacuation method is being followed. So these are the parts of dismembered fetus after this dilatation and evacuation procedure. This is the extraembryonic installation of hypertonic saline. After amniocentesis, that means perabdominally and ultrasound guidance, that using the syringe, some 50 ml of amniotic fluid is taken out, aspirated using the syringe, and the same amount, 50 ml, is replaced by this hypertonic saline. That is a 3% saline or urea solution, etc. That is introduced into the amniotic solution, that amniotic fluid. The fetus consumes hypertonic saline or urea, it dies, then it is expelled. That's all. The fetal death is caused by this hypertonic saline. Then prostaglandins can be administered to promote the uterine contractions. The advanced stage of pregnancy in the third trimester and all, hysterectomy is used. That means it's nothing similar to cesarean section. That's all. Uterus is cut open and it is fetus is taken out, similar to cesarean section. That is called a hysterectomy. Hysterectomy, not hysterectomy. Hysterectomy means removal of uterus. Hysterectomy is similar to cesarean section. With this various methods of conduction of MTP, we come to these duties of doctor in dealing with a case of criminal abortion. When a case of attempted criminal abortion comes for treatment to the doctor, what is his role? In the situation, doctor should not treat her as a criminal. She has to be given proper treatment. She has to be taken care of well by the doctor with empathy. So history taking, doctor should ask her where the incident happened, what method adopted, who has done it, what is the procedure involved, what are the complications after that. So the detailed history from the time of conduction of criminal abortion till the arrival, what happened. The doctor should encourage the patient to give proper history. If she doesn't want to reveal anything, then doctor should not force her to make statement. She has to focus on saving the life of the pregnant woman by giving proper treatment. In dealing with the case of attempted criminal abortion, either self-abortion or conducted by some abortionist, it is always, if the doctor is not a specialist, then it is better to have a SAN consultation. Better to have a consultation with a specialist physician about the case, how to treat it, what are the medical legal cases. Always get a consultation with a obstetrician. Then treat her to the best of his ability. Maintain proper day-to-day records. The records of the patient. What are the findings? What are the investigations? Management details. That is a treatment. All these should be recorded clearly in the hospital record. That also has to be maintained. Then preservation of evidence to prove the criminal abortion. In case if a woman wants to make the police complaint, then what are all the materials to be preserved from her, like all soiled clothes, any foreign material collected from the genital tract, like evidence of these abortifacient drugs, abortion sticks that are still retained, any chemicals that are retained inside the cervix or vagina or uterus, syringes, twigs still remains in the cervix or vagina, etc. All these have to be preserved and handed over to the police or sending to the respective laboratory for detection of chemicals, etc. Then professional secrecy, like any MTP center that we already discussed, contravening professional secrecy like that. So here also, in this case also, professional secrecy should be maintained. Without her consent, especially, it should not reveal these incidents to anyone unauthorized persons. The woman is too sick. If the doctor believes she is terminally ill and death can happen any time, then dying declaration has to be got by the doctor. Preferably by the magistrate, it has to be recorded. If there is imminent danger of death of the pregnant woman is expected, then if there is a delay on the part of magistrate can happen, then doctor himself can record the dying declaration in the presence of witnesses. Doctor can himself record the dying declaration from the victim of criminal abortion. She will tell what are the circumstances leading to death, who are the persons responsible, what methods, who has done that. If she wants to, whatever she wants to reveal at the time of death, it can be recorded by the doctor himself. Suppose a woman dies in spite of treatment or due to complications, then if the death occurred, doctor should not issue the death certificate as he is issuing in case of a natural death. In case of criminal abortion, the death occurred, then even after getting the dying declaration, woman dies, then death certificate should not be issued. Instead, the doctor has to inform the police. They will arrange for post-mortem in the nearby that postmortem center, where the doctor who is conducting the abortion on the body of a criminal abortion victim, that doctor will provide in the autopsy report the cause of death. Doctor need not issue the death certificate mentioning the cause of death as he is doing in the natural normal deaths. So these are all the certain legal duties pertaining to criminal abortion. Die in declaration, death certificate should not be issued, postmortem should be done. Doctor should not hand over the body to the relatives for disposal. Doctor has to inform the matter to the police, and they will arrange for postmortem where the cause of death is revealed after the autopsy. Then, causes of death in criminal abortions. What are the causes causing imminent, immediate death, delayed death, remote death? Immediate death means occurring within minutes of attempting criminal abortion, like embolism. A woman may die due to air embolism, amniotic fluid embolism, fat embolism due to syringing, all these, or air insufflation, etc. Then shock and hemorrhage due to perforation of hemorrhage, intraperitoneal or extraperitoneal hemorrhage occurring, leading to shock, hypovolemic shock, etc., secondary to instrumentation, careless instrumentation. Vagal inhibition, secondary to introduction of any that instruments, very hot or cold instruments, sudden introduction of instruments into the cervix or uterus without proper lubrication or anesthesia may cause a vagal inhibition of the heart and a sudden death of the pregnant woman. Then poisoning, sometimes overdose of poisoning may cause immediate death. That is, death by poisoning is very rare. Causing immediate death is rare. Delayed death may occur in the situation. Delayed death means within 2 to 3 days, like local infections, peritonitis, septicemia, cervicitis, vaginitis, etc. Then pyemia, standard to pelvic abscess, toxemia, tetanus. All these are common complications of criminal abortions leading to death, which are called delayed deaths if the death occurs in the 2 to 3 days of the event. Then remote deaths, that is after weeks after the abortion, that after the procedure is employed. After the case of criminal abortion, those deaths occur after weeks after the procedure, they are called remote deaths. Common causes causing a delayed death are jaundice or hepatitis or renal failure, secondary to complications of criminal abortion. Then bacterial endocarditis, pulmonary embolism, secondary infections like pneumonia, emphysema, meningitis. These are all serious infections leading to maternal deaths, delayed deaths. These are all the various complications as well as causes of death in criminal abortion. In the picture you can see a lot of infections like oophoretis affecting the ovaries, salpingitis, endometritis and metritis, thrombophlebitis, then uterine perforation, intestinal injuries, all these are all the complications or causes of death in criminal abortions. As you are seeing left side picture, rupture of uterus, on the right side denoted by arrow, on the left side there is a extruded amniotic sac along with the fetus, a complication of criminal abortion that is being noticed in the postmortem or autopsy. The right picture, the abortion, the criminal abortion uterus showing blood clots, again a case of abortion in autopsy. And what are the samples to be collected in criminal abortion during autopsy, after death in the postmortem? Vaginal contents pipetted out in a clean sterile container for chemicals, drugs and soap that we can employ in the living victims that is being pipetted out. Pubic hair samples, blood, urine, stomach contents, and the autopsy, blood from the inferior vena cava and both cardiac ventricles, any fluid from uterine cavity may show the chemicals, etc. Swabs from the uterine wall again for histopathological examination as well as for detecting chemicals, agents used for criminal abortion, tissues for histology from all organs. So lastly, we have come to differences between natural and criminal abortion, how to find it out. So depending on the cause, criminal abortion is common in case of unmarried women or widows, or even in married women sanitary to illicit intercourse if they become pregnant, whereas natural abortion predisposing diseases like chromosomal abnormalities, etc. Injuries of genital organs, violence on the body, foreign materials in the genital tract, fetal injuries, toxic effects of drugs or infections, sanitary infections like pneumonia, meningitis, peritonitis, all are absent in case of natural abortion, whereas criminal abortion, these are all very common, especially injuries to the genital tract like contusions and lacerations of cervix, vagina, or any inflammation of a vagina or cervix or GIT or urinary tract due to abortifacient drugs employed. Then these are all the indications to differentiate between criminal and natural abortions, especially during this autopsy. Coming to this uh, as a revision, let us review what we have learned so far. I will pause for a moment and you try to find the answer. Abortion is defined, just to pause it and you can try to find the answer yourself. Abortion is defined as expression of products of conception, legal definition. So any period, okay, before full term is the answer here. Year of MTP Act, first 1971. Amendment is, if it is asked, you have to tick for 2021. Okay, 50 years later, amendment. Opinion of two doctors, that is as per recent amendment. It is up to how many weeks? 20 to 24 weeks. That is the opinion of two doctors is necessary with the period of gestation is about 20 weeks up to 24 weeks. Beyond 24 weeks, that board is required. Suppose if they mention clearly in the 1971, up to 12 weeks single doctor, 12 to 20 weeks is the two doctors' opinion. Indications of MTP are all except pregnancy due to rape, contraceptive failure. So rape, humanitarian, contraceptive, social, pregnancy endangers, therapeutic, maternal age is not the criteria. As far as MTP is allowed or denied, age is not the criteria. Okay. As per MTP Act, abortion can be done by opinion of one doctor alone. That is, if you take a recent amendment only, if the year is not mentioned, always go for recent amendment. The choice is specific for the recent amendment, you have to go for that only. So one doctor, that is 20 weeks. 1971 is mentioned, 12 weeks. Under MTP Act, termination of pregnancy can be done by any RMP, correct? Any RMP with diploma or PG degree, correct? Any RMP with 6 months of house service in any department. It should be in OG department. No? Any RMP with a minimum of 2 months of residency in O and G. Who can do it? Any registered medical practitioner can be done, but prescribed experience only it can be done. Only in emergency it can be done. Whereas elective MTP, it cannot be done. Okay. So the answer is here B. Any RMP with a diploma or PG degree, irrespective of duration, it can be done. For any RMP also can be done with the necessary experience like 6 months of house agency that we already discussed. Opinion of state medical board is required for MTP for beyond 24 weeks. Only indication is substantial fetus risk. Abortions are most common during the first month or second and third month. It is first trimester, but second and third month is the answer here. Principal cause of abortion in the first trimester is chromosomal abnormalities, that too trisomy 16. Section 312 IPC is related to criminal negligence, attempted suicide, culpable homicide, criminal abortion. 312 to 316 IPC as well as 511 IPC all are pertaining to criminal abortion in India. All statements are true regarding MTP Act except that is 1971 correct. MTP Act that is after MTP Act introduction, incidents of legal abortions especially undertaken by unmarried women, widows, even married women with illicit intercourse, all these death due to sanitary complications which are very common before 1971, because of which to reduce the mortality only this MTP Act with liberalized indications have been introduced. So that also correct. It has part on Lot of thousands of women died every year before 1971 due to complications. That has been drastically brought down after introduction of 1971 MTP Act. Emergency pregnancy can be detected single doctor even after 20 weeks without, beyond 20, irrespective of duration, in any place without the necessary experience, any doctor with MBBS to save the life of pregnant woman in emergency, it is permitted. In the situation, he won't be punished for MTP Act of 2 to 7 years or IPC sections governing criminal abortion between 312 to 316, etc. So, if the doctor act in any doctor act in good faith according to save the life of pregnant woman or according to provisions of MTP Act of 2021, he will be exempted from the punishment from any of these sections of 312 to 315, 316 IPC. MTP can be done after 24 weeks of gestation if two doctors act. After 24 weeks, the medical board is required. Which of the following is incorrect for terminating pregnancy? It is enough for the woman to state that she was raped. The woman says above 16 years, sorry, she is above 18 years also, it has to be accepted. Doctor need not ask for the police complaint. First she has to lodge, then only MTP can be done. Doctor should not insist a police complaint or proof for her age of 18 years also. Professional secrecy has to be maintained. Yes, that is correct. Pregnancy terminated if the period of pregnancy is below 24 weeks. Now, two doctors' opinion is required between 20 and 24 weeks. Abortion, 30 kg weight woman unmarried is to be considered on what grounds? Therapeutic. Anyway, as far as pregnant woman is concerned, it is a therapeutic indication only. Here, underweight woman, there is a risk of health to carry the pregnancy till term. Whether married or unmarried, here it is not the question. It's an underweight woman, it is high risk. So therapeutic ground. For procuring criminal abortion, mechanical interference is usually resorted. Mechanical interference, as we have seen, it is in the third or fourth month, I think. Third or fourth month. First month is mechanical violence. If that fails, abortifacient drugs in the second month. Third month is the mechanical interference like abortion stick. That and all we have already discussed. Cupping is the general violence in the first month. All of the following are methods of procuring abortion by general violence except just so we have discussed cupping. Cupping is the general violence the first month. Violent exercise, severe pressure on the abdomen, massaging, rupturing of membranes, that is a local method. Rupturing of membranes, abortion stick and all local method. Injection of fluid into the uterus causes abortion due to any fluid or air insufflation causes detachment of placenta and amniotic sac from the uterine walls, thereby causing expulsions. So first choice is correct. Common method of resorted for procuring criminal abortion, the third and fourth month, that we have already discussed, that is the rupturing of membranes by abortion stick. Mechanical interference is generally implied, like abortion stick in the third and fourth month. Drugs, second month, violent exercise and all, skipping all these will cause, may not cause also. That and all first. Drugs second month, violent exercise first month, dilatation and curettage again, that is in the initial dilatation and curettage is also generally in the initial period of this first trimester. Dilatation of cervix for procuring criminal abortion is done by introducing following into the cervical canal, except cervical canal, slippery embark, laminaria tent or C-tangle tent, both are same only. They are all placed in the cervix only. They are hygroscopic, absorb water and swells and leading to dilatation of cervix and expulsion. Whereas abortion stick is introduced with the paste applied and chemicals applied and introduced into the uterus. So risk is uterine perforation here. Abortion stick causes abortion due to what it will cause? Uterine contractions, necrosis, infection of uterine wall, detachment of placenta, stimulation of uterine nerves, that will cause inflammation of uterine wall and causing uterine contractions. MTP in the first trimester, medical termination of pregnancy, not criminal abortion. Vacuum aspiration, dilatation, curettage, lower rupture of membranes. Vacuum aspiration is the best performed. DNC also will work out, but vacuum aspiration, because of less complications compared to DNC, it is more preferred. Most commonly used abortifacient is occurring criminal abortion is quinine, ergot, synthetic, but especially among the ecbolic. It should be ecbolic. Among the ecbolic, ergot is the most commonly used. Abortion at 11 weeks of pregnancy can be done by, that is in the first trimester. MTP can be done by, that is a vacuum aspiration or section evacuation. First trimester abortion uses all except mifepristone yes up to 9 weeks. Extra-amniotic is in lactate. Dilatation and evacuation, yeah, it can be done. Suction evacuation can be done. Vacuum aspiration. Extra-amniotic is the exception here. So these are all the references. I thank you for all the authors as well as Dr. Professor Suresh Badamath from NIMHANS on his topic of MTP Act Amendment of 2021. Thank you very much for this patience listening of almost 2 hours. Hope this session was helpful. If you find it useful, you can refer to your friends, studying in other colleges too. So thanks for watching, and I will meet with the next topic soon. Thank you very much. If you have any doubts, you can put in the comment section. Bye.